SDOH are the social determinants of health, and really it's what in the community, what in people's environments that are affecting their health. So the things that we look at are housing. Do they have stable housing? Do they have food? Do they have transportation? And the thing that is really crazy is I'll be talking to somebody and I think that like they have everything they need and everything is good, but when you start asking them those questions, you know, they really shock you sometimes. This member came to me as a high-risk pregnancy, so I outreached the member, and initially when I talked to her, she had a history she had bipolar, depression, anxiety, and a suicide attempt. She ended up delivering in her apartment, and so it all happened kind of quick. Once I identified that the member really could benefit from a social worker referral and the member was agreeable, I got Renee involved.
So I followed up with her when she was discharged home with the baby, and we talked about, you know, what her needs and concerns were. Tara, the nurse, was reaching out about her high-risk pregnancy needs, and I was reaching out to her based on her social determinants of health needs. I provided her with a lot of guidance and, you know, direction on resources to meet her needs: financial, food assistance, transportation, how to apply for WIC, which is the Women, Infants, and Children's Program, to help the child. You know, with a little bit of support from me, she was able to, you know, get some of her needs met, but it wasn't all done on the second call. But by our last contact, she had all of her benefits squared away, she had resources in place, and she was back to work, and the baby was doing good.
I love what I do because it's very, very rewarding to have such a positive impact on our members. Giving the member the resources and making those resources available so that they can use those to have the best outcome and to stay healthy and to, you know, for their well-being.
You know, I just try to help people every day. Like I try to give them 100%, you know, connect them the best that I can. You know, it's just who I am. I'm a social worker, and, you know, I like what I do, and it's rewarding, and I like to, you know, make a difference for people.